Operating room surgical technician. Significant points. Training programs last 4 to 24 months and lead to certificate, diploma, or associate degree. Job opportunities are expected to be favorable. Hospitals will continue to be the primary employer, although much faster employment growth is expected in offices of physicians and in outpatient care centers, including ambulatory surgical centers. Nature of the work. Surgical technicians, also called scrubs, and surgical or operating room technicians assist in surgical operations under the supervision of surgeons, registered nurses, or other surgical personnel. Surgical technicians are members of operating room teams, which most commonly include surgeons, anesthesiologists, and circulating nurses. Before an operation, surgical technicians help prepare the operating room by setting up surgical instruments and equipment, sterile drapes, and sterile solutions. They assemble both sterile and non-sterile equipment, as well as adjust and check it to ensure it's working properly. Technicians also get patients ready for surgery by washing, shaving, and disinfecting incision sites. They transport patients to the operating room, help position them on the operating table, and cover them with sterile surgical drapes. Technicians also observe patients' vital signs, check charts, and assist the surgical team with putting on sterile gowns and gloves. During surgery, technicians pass instruments and other sterile supplies to surgeons and surgeon assistants. They may hold retractors, cut sutures, and help count sponges, needles, supplies, and instruments. Surgical technicians help prepare, care for, and dispose of specimens taken for laboratory analysis and help apply dressings. Some operate sterilizers, lights, or suction machines and help operate diagnostic equipment. After an operation, surgical technicians may help transfer patients to the recovery room and clean and restock the operating room. Working conditions. Surgical technicians work in clean, well-lighted, cool environments. They must stand for long periods and remain alert during operations. At times, they may be exposed to communicable diseases and unpleasant sights, odors, and materials. Most surgical technicians work a regular 40-hour week, although they may be on call or work nights, weekends, and holidays on a rotating basis. Employment. Surgical technicians held about 72,000 jobs in 2002. About 3/4 of jobs for surgical technicians were in hospitals, mainly in operating and delivery rooms. Other jobs were in offices of physicians or dentists who perform outpatient surgery and in outpatient care centers, including ambulatory surgical centers. A few known as private scrubs are employed directly by surgeons who have special surgical teams, like those for liver transplants. Training, other qualifications, and advancement. Surgical technicians receive their training in formal programs offered by community and junior colleges, vocational schools, universities, hospitals, and the military. The major certifying organizations for operating room technicians is the Commission on Accreditation of Allied Health Education Programs, CAA-HEP. Other organizations include the National Healthcare Career Association, National Board of Surgical Technology, and Surgical Assisting, etc. High school graduation is usually required for admission. Programs last 4 to 24 months and lead to certificate, diploma, or associate degree. Programs provide classroom education and supervised clinical experience. Students take courses in anatomy, physiology, microbiology, pharmacology, professional ethics, and medical terminology. Other studies cover the care and safety of patients during surgery, sterile techniques, and surgical procedures. Students also learn to sterilize instruments, prevent and control infection, and handle special drugs, solutions, supplies, and equipment. Surgical technicians need manual dexterity to handle instruments quickly. They also must be conscientious, orderly, and emotionally stable to handle the demands of the operating room environment. Technicians must respond quickly and know procedures well to have instruments ready for surgeons without having to be told. They are expected to keep abreast of new developments in the field. Recommended high school courses include health, biology, chemistry, and mathematics. Technicians advance by specializing in a particular area of surgery, such as neurosurgery or open heart surgery. They also may work as circulating technicians. A circulating technician is the unsterile member of the surgical team who prepares patients, helps with anesthesia, obtains and opens packages for the sterile person to remove the sterile contents during the procedure, interviews the patient before surgery, keeps a written account of the surgical procedure, and answers the surgeon's questions about the patient during the surgery. With additional training, some technicians advance to first assistants, who help with retracting, sponging, suturing, cauterizing bleeders, and closing and treating wounds. Some surgical technicians manage central supply departments in hospitals, or take positions with insurance companies, sterile supply services, and operating equipment firms. Job outlook. Job opportunities are expected to be favorable. Employment of surgical technicians is expected to grow faster than the average for all occupations through the year 2020 as the volume of surgery increases. The number of surgical procedures is expected to rise as the population grows and ages. As members of the baby boomers generations approach retirement age, the over 50 population, who generally require more surgical procedures, will account for a larger portion of the general population. Technological advances such as fiber optics and laser technology will also permit new surgical procedures to be performed. Hospitals will continue to be the primary employer of surgical technicians, although much faster employment growth is expected in offices of physicians and in outpatient care centers, including ambulatory surgical centers. Earnings. Median annual earnings of surgical technicians were $31,210 in 2002. The middle 50% earned between $26,000 and $36,740. The lowest 10% earned less than $21,920, and the highest 10% earned more than $43,470. Median annual earnings of surgical technicians in 2002 were $33,790 in offices of physicians and $30,590 in general medical and surgical hospitals. Operating room surgical technician. The educational program's subject content must be directly related to 1. Decontamination of surgical instruments, 2. Preparation and packaging of surgical instruments, 3. Sterilization of surgical instruments, 4. General knowledge of instrumentation. Exam. Roles and responsibilities, 18% of the exam. Life sciences, 10% of the exam. Decontamination, 22% of exam. Preparation and handling, 18% of exam. Sterilization, 20% of exam. Sterile storage and distribution, 12% of exam. Introduction. This program is designed to prepare the student with the necessary knowledge and skills needed to gain employment as a surgical technician. Students will study all aspects of surgery, including law and ethics surrounding surgeries, surgical environment, pharmacology, microbiology, sterilization, aseptic techniques, OSHA, transportation and positioning surgical patient, wound closure, anesthesia, instrument exchange and count, surgical instruments, surgical emergencies, communication skills, medical terminology, anatomy and physiology, and surgical procedures for the various medical specialties. Objective. Upon successful completion of this program, the student is eligible to challenge national certification exams, such as the National Healthcare Association Certification Exam as an operating room surgical technician, course, and will become employable in various surgical environments such as hospitals, surgical units, and surgeons' offices. Orientation to surgical technology. This course is designed to introduce the student to the field of surgery and will include history, legal and ethical aspects of surgery, and patient care. An overview of the ORST is defined in this class. Objectives: 1. Understand and discuss the development of the ORST. 2. Describe the role of the ORST as a team member. 3. Understand the significance of certification. 4. Describe and discuss the value of teamwork within the OR arena. 5. Discuss and understand surgical conscience. 6. Understand the importance of laws pertaining to surgery. 7. List federal regulations that affect surgical technicians. 8. Define medical practice acts. 9. Understand malpractice insurance. 10. Define negligence and defamation. 11. Discuss and respond to the 4 categories of errors in the operating room. 12. Define the roles of those who work in surgery. 13. Describe the supplies in the OR. 14. Describe the equipment found in the OR suite. Fundamentals of surgical care. This course is designed to emphasize theoretical applications in the areas of microbiology, disinfection, sterilization, aseptic techniques, universal precautions, and the sterile field. A study of standard protocol for the protection of the healthcare worker and patient to ensure the procedures and treatments prescribed by the physician are safely and properly performed to assist the patient's return to health. Overview of classification of microorganisms, culture sensitivities, causes and prevention of chain of infection. This course also includes Introduction to OSHA standards and regulations. Objective: upon completion of this course, the student will 1. Understand basic bacterial structure and physiology. 2. Understand and discuss the process of disease transmission. 3. Understand and discuss the infection process. 4. Identify wound classifications. 5. Understand and discuss universal precautions. 6. Understand and discuss OSHA regulations as pertaining to the ORST. 7. Name the common pyogenic bacteria. 8. Understand the significance of hepatitis B in the healthcare setting. 9. Identify the body fluids through which AIDS may be transmitted. 10. Discuss and distinguish between disinfecting and sterilization. 11. Recognize the hazards associated with the use of chemical disinfectants. 12. Understand sanitation and how it is accomplished. 13. Understand the process of instrument decontamination. 14. Understand the post-surgical duties of the scrub assistant. 15. Understand personal protective equipment. 16. Describe the different methods of sterilization used in the operating room. 17. Properly load the steam sterilizer. 18. Understand and practice safety precautions when using any type of sterilizer. 19. Determine appropriate sterilization process for equipment. 20. Understand the principles of gas sterilization. 21. Prepare equipment for sterilization. 22. Describe and understand aseptic technique. 23. Explain the rules of asepsis. 24. Describe proper surgical attire. 25. Demonstrate the proper technique for hand washing. 26. Demonstrate techniques used to maintain asepsis in the operating room. Surgical pharmacology. This course is designed to teach the student weights and measures, basic arithmetic review, accepting and distinguishing medications in surgery. The students will also study the generic trade names, uses, and actions of common medications. Objectives: upon completion of this course, the student will be able to 1. Convert to and from the metric to the apothecary system. 2. Perform basic math calculations. 3. Receive medications from the registered nurse properly. 4. Discuss and understand the basic types of medications commonly used in surgery. 5. List the names of medications commonly used in surgery. 6. Understand generic and trade names of the common medications. Principles of Surgical Technology. This course is designed to provide the student with skills in basic surgical techniques, including transporting, positioning, and draping the surgical patient, skin preparation and wound closure, vital signs, homeostasis, and anesthesia. Objective. Upon completion of the course, the student will 1. Distinguish between general and conductive or local anesthesia. 2. Describe the phases of general anesthesia. 3. Describe the components of the gas anesthesia machine. 4. Define semi-closed or open anesthesia system. 5. Define closed anesthesia system. 6. Define conscious sedation. 7. Become familiar with common anesthesia agents. 8. Define and discuss different types of conductive anesthesia. 9. Recognize the adverse effects of local anesthesia. 10. Recognize classifications of anesthetic adjuncts. 11. Transfer the conscious and unconscious patient from bed to stretcher. 12. Transport the patient to the operating room or other locations within the hospital. 13. Describe the safe positioning of the patient. 14. Define residence and transient flora. 15. Demonstrate proper techniques used in hair removal from the surgical site. 16. Demonstrate proper techniques used in patient skin preparation. 17. List commonly used antiseptics. 18. Demonstrate knowledge of commonly used drapes. 19. Demonstrate proper techniques used in draping. 20. Discuss suture material, sizing, and packaging. 21. Describe the two main categories of such materials. 22. Discuss and demonstrate the proper handling and preparation of suture materials. 23. Describe and recognize different types of surgical needles. 24. Recognize parts of surgical needles. 25. Demonstrate proper techniques for threading and passing suture needles. 26. Discuss non-suture products. 27. Recognize and properly load and unload cartridges of surgical stapling instruments. 28. Understand wound healing. 29. Describe the functions of dressing and wound drains. 30. Understand the process of homeostasis. 31. Understand and describe and use the components of electrosurgery. 32. Differentiate between monopolar and bipolar electric surgical units. 33. Demonstrate the principles and practices of the patient grounding pad, grounding cable, and power unit. 34. Describe the different types of sponges used in surgery. 35. Demonstrate the proper method for taking sponge count. 36. Recognize the consequences of losing a sponge within a surgical wound. 37. Understand how a pneumatic tourniquet operates. 38. Discuss types of pharmaceutical hemostatic agents. 39. Discuss hypothermia. 40. Discuss hypotension. 41. Describe types of autotransfusion. 42. Describe and demonstrate proper techniques for obtaining vital signs and their role in surgery. Operating room skills. This course focuses on preoperative, interoperative, and postoperative techniques such as communicating with the patient, instruments, instrumentation, and instrument count, surgical routines and emergencies, and laser technology. Objective. Upon completion of this course, the student will 1. Identify the components of a surgical instrument. 2. Recognize the different types of instruments by category. 3. Care for instruments by category. 4. Use effective memorization skills in learning the names of surgical instruments. 5. Understand the sequence of events in a surgical procedure. 6. Demonstrate teamwork and courtesy in professional relationships. 7. Respond appropriately to different types of surgical emergencies. 8. Understand why a registered nurse must fulfill the role of a circulatory during surgical procedures. 9. Understand what patient care plans are and the nurse's role in the development. 10. Describe the 3 types of lasers. 11. Understand how lasers work. 12. Describe all safety precautions taken with laser use. 13. Describe the role of the scrub assistant when the laser is used. 14. Define the role of the circulator when the laser is used. Communications and Behavioral Sciences. This course is designed to provide the student with skills for effective listening and interpersonal relations, verbal and nonverbal methods of communication, and appropriate responses to psychosocial stress in the surgical patient. Objective. Upon completion of the course, the student will 1. Understand what patient care plans are and why they are developed. 2. Discuss common psychological concerns of the surgical patient. 3. Understand the special needs of the pediatric patient. 4. Understand the special needs of the geriatric patient. 5. Understand the special needs of the obstetric patient. 6. Become aware of cultural and ethnic differences that affect the surgical patient. 7. Understand HIPAA privacy regulations and how they apply to the ORST. Medical terminology, anatomy, and physiology. This course is designed to provide the student with the fundamental facts and principles of the human structure, anatomy, and function, physiology, through the application of medical terminology. Objective. Upon completion of the course, the student will 1. Identify the roles of prefixes, suffixes, and combining forms in constructing medical terminology. 2. Understand and analyze medical terms. 3. Recognize, spell, define, and pronounce terms related to the skeletal, muscular, cardiovascular, lymphatic, immune, respiratory, digestive, urinary, nervous, senses, integumentary, endocrine, and reproductive system. 4. Identify buoy planes, directions, and cavities. 5. Identify and describe the major structures and functions of the skeletal system. 6. Describe 3 types of joints. 7. Describe the structures and functions of the muscular system. 8. Describe the heart in terms of chambers, valves, blood flow, blood supply, and heart sounds. 9. Differentiate among the 3 types of blood vessels and describe the major functions of each. 10. Identify the major components of blood and the major function of each. 11. State the differences between systemic and pulmonary circulation. 12. Describe the major functions and structures of the lymphatic system. 13. Identify and describe the major structures of the digestive system. 14. Identify and describe the major structures and functions of the digestive system. 15. Describe the process of digestion, absorption, and metabolism. 16. Identify and describe the major structures and functions of the urinary system. 17. Identify and describe the major structures and functions of the nervous system. 18. Identify the 3 major divisions of the nervous system. 19. Identify the major parts of the brain by location and function. 20. Describe and identify the structures and functions of the sense organs. 21. Identify and describe the structures and functions of the integumentary. 22. Describe at least 10 types of lesions. 23. Describe the role of the hypothalamus and endocrine glands in maintaining homeostasis. 24. Name and describe the functions of the hormones secreted by the endocrine glands. 25. Identify and describe the structure and functions of the male reproductive system. 26. Identify and describe the structures and functions of the female reproductive system. 27. Describe pregnancy, childbirth, and postpartum. 28. Recognize, spell, define, and pronounce basic medical terms. Surgical procedures. This course is designed as a study of a system approach to surgical procedures and regional anatomy. Specialty equipment, types of incisions with the emphasis on the role of the scrub technician in areas of general, obstetric, and gynecologic, urogenital, orthopedic, cardiothoracic, peripheral vascular, neuro, ophthalmic, pediatric, ENT, plastic and reconstructive surgery. Didactic instructions to include the following surgical specialties. 1. General and gastrointestinal. 2. Obstetric and gynecologic. 3. Urogenital. 4. Orthopedic. 5. Cardiothoracic. 6. Peripheral vascular. 7. Neurosurgery. 8. Ophthalmic. 9. Ears, nose, and throat. 10. Pediatric. 11. Plastic and reconstructive surgeries. Instructions to include the following for each of these specialties. 1. Pathology that prompts surgical intervention. 2. Instruments, suturing materials, and appropriate supplies for selected procedures. 3. Incisions. 4. Draping. 5. Patient positioning. 6. Skin and site preparation. 7. Procedure descriptions including possible complications. 8. Role and function of the scrub technician. 9. Regional anatomy. 10. Purpose, direction, and final goal of procedures. Career development. This course is designed to assist the student in resume development, soft skills, interviewing strategies, and decision-making skills to assist the student in obtaining employment. Optional externships are encouraged to offer the student the opportunity for real-life experience. Externship. The students will gain experience in surgical technology by applying skills and techniques learned in an actual surgical environment, with a variety of cases under direct supervision. Objective. Upon completion of this externship, the student will be able to 1. Develop an understanding of how skills and techniques acquired during the programs are applied in an actual surgical environment. 2. Build experience working in the field of study. 3. Build experience with patient relations. 4. Build experience with personal and professional relations. Operating room surgical technician. Task, competencies. Exploring the world of surgical technology. Explain the purpose and job description of a surgical technologist. Describe the roles of members of the surgical team. Identify types of hospitals. Explain hospital structure and chain of command in the operating room. Explain the purpose of hospital departments on which surgery depends to give continuity of patient care. Identify means of on-the-job communication. State the purpose of communicating among team members and between hospital departments. Tour the hospital with attention to areas such as emergency rooms, radiology, laboratory, blood bank, and pathology. Tour the operating room. Identify restricted and non-restricted areas of the operating room. Differentiate between scrubbed and unscrubbed members of the surgical team. Applying aseptic technique. Wash hands using medical asepsis. Demonstrate surgical scrubs. Operate surgical supplies, linen wrapped and disposable. Don and remove surgical gloves, open, closed, change of contaminant gloves. Don and remove surgical gown. Gown and glove another person. Performing sterilization procedures. Sterilize instruments and supplies. Steam. Sterilize instruments and supplies, gas. Sterilize instruments and supplies, cold. Sterilize instruments and supplies, steris. Performing emergency procedures. Demonstrate CPR. Maintain emergency equipment. Apply fire safety procedures. Apply emergency procedures, pre and post induction. Apply cricoid pressure. Assemble suction apparatus. Set up IV. Measure vital signs. Demonstrating preoperative procedures. Position patient. Perform skin preparation procedures, surgical cleansing, shave prep. Verify safe environment, check electrical equipment, check sterility indicators, check atmospheric conditions. Set up instrumentation, measure and pour solutions. Drape Mayo tray and stand. Drape patient for surgery, abdominal, extremity head face. Demonstrating intraoperative procedures. Perform surgical counts. Prepare and pass instruments. Prepare and handle suture material. Assemble electrocautery equipment. Prepare tissue specimens for the lab. Assemble the drains and equipment. Demonstrate post-operative procedures. Transfer patient to stretcher. Measure suction container contents. Prepare supplies and instruments for sterilization. Demonstrate terminal disinfection. Apply sterile dressings. Disassemble electrocautery unit. Insert, connect, indwelling Foley catheter. Simulated. Demonstrating positive interpersonal relationships with staff members, surgeons, peers, and patients. Display therapeutic communication skills with coworkers and with patients, including handling concerns about surgery and sexuality and about death and dying. Check patient identification. Demonstrating basic surgical techniques. Apply basic surgical techniques in minor surgery. Apply basic surgical techniques in general surgery. Apply basic surgical techniques in OB/GYN surgery. Apply basic surgical techniques in plastic surgery. Apply basic surgical techniques in ENT surgery. Apply basic surgical techniques in ophthalmic surgery. Apply basic surgical techniques in orthopedic surgery. Apply basic surgical techniques in arthroscopic diagnostic surgery. Apply basic surgery techniques to GU surgery. Apply basic surgical techniques in neurosurgery. Apply basic surgical techniques in cardiothoracic surgery. Displaying initiative in surgical situations. Demonstrate the ability to scrub alone on minor procedures. OR nurse or technician must be available and in the room. Display organizational skills, including setting priorities. Demonstrate leadership qualities. Observing highly specialized procedures. Observe surgical procedures in neurosurgery, e.g. craniotomy. Observe surgical procedures in cardiovascular surgery, e.g. open heart surgery, demonstrating technical knowledge. Use medical terminology as appropriate. Apply medical ethics and laws. Describe structure and function of body systems. Explain basic concepts of microbiology. Describe procedures of anesthesia, including drugs. Applying safety procedures. Provide a safe, clean, comfortable environment for the client. Locate fire alarms, exits, and explain fire safety procedures in the operating room. Demonstrate the proper body mechanics. Explain blood-borne pathogens and the exposure control plan for staff and students in the operating room. Implement universal precautions and infectious disease control measures. Explain chemical hazards and procedures to follow in case of chemical spill or contamination. Identify other environmental safety hazards, prevention methods, and disaster plans. Identifying principles of asepsis. Trace the historical background of asepsis. Define terms related to asepsis. Identify sources of contamination. Identify the methods of environmental control of contamination. Identify the 12 principles of asepsis. Define surgical conscience and relate it to the principles of asepsis. Demonstrate the procedure for terminal disinfection. Demonstrate the procedure for open sterile items and delivering them to the sterile field. Demonstrate the principle of asepsis followed during the surgical procedures. Communicating effectively. Identify body language as a form of communication. Explain zones of space in communication. Describe the types of correspondence used in the application process. Explain important factors in completing a job application. Identify qualities evaluated during job interviews. Demonstrate interview strategies. Define terms related to resume writing. Identify 4 types of resumes. Identify goals and objectives of a resume. Identify the components of a resume. Prepare a resume. Describe factors important for job retention. Examining all aspects of industry. Planning, management, finance, technical and production skills. Underlying principles of technology. Labor issues. Community issues. Health, safety, and environmental issues.